insert your clothes in the basket and then opening in the back for the gown.
Okay, perfect. Okay.
I'll be in just a second. So I'm Dr. Struck's nurse. I'm going to go over a little bit of paperwork with you. This is your consent for surgery. So your surgeon today is going to be Dr. Struck. And then the procedure you guys talked about, and if there's anything that you guys added or let me know. But it was liposuction of the arms, back, chin, hips, middle thigh, and then we're going to take that fat and do a fat graft, put that in the booty for a BBL. We're going to do a Mastopexy, which is a breast lift, and we're also going to do an augmentation at the same time, which is the implant. Doing abdominoplasty or a tummy tuck, and then we also added the upper lip bleph, and then we're going to remove that little piercing there as well.
And then, I don't know if this matters, the abdominoplasty was the
extended.
I don't know if that makes a difference.
Perfect. So I'll go ahead and have you read all of this. And then you will, this is just consent for surgery, letting you know that there's some risk associated, sign, date, and time. On this page, this is your consent for general anesthesia. You are having general anesthesia, and then I believe your anesthesiologist is Dr. Zephyr. And then sign, date, and time here. This is paperwork for consent for COVID-19. You might be exposed to that. Malignant hypothermia questionnaire. This is extremely rare. If you've never heard of it, that's great. It probably doesn't run in your family, but I need you to check yes or no to all of these, sign and date. And then the last page today, just a reminder, don't stay home alone today. You're gonna wanna stay in a flex position, so if you pillows prop behind your back, some below your knees, and stay in that flex position. The swelling is going to, that position is going to help with the breast, it's going to help with the eyes and the tummy. You can't really protect the booty too much, but right now the booty is the least of our concern. You might have a little bit of sore throat, that's totally normal, a little bit of hoarseness in your voice as well, very, very normal. But don't sign any legal paperwork, don't operate a heavy vehicle. You got good support over here, so. And then Dr. Struck will see you tomorrow back at the Loscato's office at 10 o'clock. Okay. Once he sees you, he's going to take off your dressings, put you into a sports bra, close you on up, and then you can go home. After he sees you, you can shower after that. Okay. We're also going to go over your medications, so let's do that real quick. So you have your arnica. Yep. Arnica is homeopathic for bruising and swelling. It looks like you took one already last night. You're going to take one when you get home and then the other one this evening before bed. Then we have promethazine. This is in case you get nauseous. Okay. This will also help you sleep a little bit more, and that's going to kind of combat your pain as well. So Percocet's going to be your pain med. We'll get you started on this in recovery, and then you can take it every 4 to 6 hours as needed for pain. Here is your Keflexin, or your antibiotic. We're going to put antibiotics in your IV, and then you're going to take your first dose tonight. After that, it's twice a day.
Oh, that's not
Zofran. So Zofran, again, if you get nauseous, you've got everything here. Yeah. But that's the best. Nobody wants to be nauseous.
No, not at all.
Do you have any questions?
I did have one. Will you give me fluids to keep me hydrated?
Okay, and I'll get that started before.
I'm so thirsty because
yeah, and I'll give you a little bit of Tylenol before as well with some water. And then I'll get you hydration pretty soon. Okay. Well, here's your pen. Go ahead and sign date, and then I'll be in just a little bit. Perfect. Thank you.
Any medical problems that you're aware of, like high blood pressure, diabetes, seizure disorder, anything?
All right, well, we're doing a journey here today, and we've got a great combination. We got a mommy makeover. How many kids did you say again?
3.
3 kids. Body stayed pretty good for that. Then you add another 60, 70 pound weight loss, and here we are. So we got a weight loss surgery and a mommy makeover, 2 of the most common things we do. And thanks for sharing your journey with us on this, because it's important. I think there are many important things. I think seeing the process makes patients feel comfortable. You're super comfortable and positive, so you're easy, but some people are scared. So we can show that. I think it's interesting also to talk a little bit while you're recovering about the recovery, because in my experience, people are more afraid of tummy tucks than they need to be. Okay. And the pain is often much less than they think. So we'll see what you think, and you can maybe share that with people that, hey, you was right, it wasn't as bad as I think. So good, so we're gonna make our plan. We'll start with the breast. We've drawn our midline, we've drawn our tangents down to the nipple. We're gonna lift the nipple pretty far. Here's our 19 centimeter point right here. That's what I measure, from here to here, 19 centimeters. From that point, we're gonna drop a line down, like this, and like this. Key points on a breast lift are, we don't remove the nipple. We just make an incision around the nipple. We take this skin away. Ballpark, we're gonna take this skin away. I measure this intraoperatively. So we take that away. So once we've removed all that skin, I lift this skin up like the page of a book. This part of your breast tissue is gonna go all the way up to here. This part's gonna go to here. And this nipple is just gonna move right up here. I'm gonna take a cookie cutter out in surgery and create a perfect circle there, and your nipple will just pop up through that. So nipple not detached, breast does this. Next question on a case like yours. Say someone like you doesn't want an implant. We can do it without an implant, we can get turkey. The implant serves a purpose of being like an internal bra that holds you up, and it gives you a perkier look for sure. So we're gonna do that too. So our final incision, circle, down, underneath, nipple placed, hold the breast up here, breast lift. Then we look out here, and we've got some breast tissue, some fatty tissue out here that we want to remove, because no one wants their boob to be wide. They want their boob to be narrow and perky, right? You're not coming here saying, I want big side boobs, please. So we will lipo those down. We'll also use that fat for your BBL. We'll lipo your arms with fat for the BBL. Arms are in pretty good shape. You don't need skin removed. I think your skin will snap down pretty well. So then we'll do the same thing over here. Narrow the base diameter of the breast, narrow the base so we have a perky lifted breast. And then we've got the breast planned out. Vertical lift, boat anchor classic lift to 19 centimeters, cookie cutter position, incisions will be there. Tummy, you're a great candidate for that. Tummy tuck, we're gonna take all this away. What happens in a tummy tuck? Well, number one, we've got a tattoo down here. Some people wanna keep their tattoo, some people don't. In your case, it needs to go, and you're ready for it to go any. But the important part of that is, if you make the incision above, right here, this is poor tummy tuck design. This is gonna give you a high scar. You're gonna see in all your clothes. You're not gonna like it. And your pubic area is gonna hang, and you're gonna feel like you have a hanging pubic area with a high tummy tuck scar, which people don't want. Come down low, under here, like this. Then we can lift this whole pubic area up like this and lipo it. That's actually one of the most common questions I get about tummy tucks is they say, please don't leave me with sagging pubic area. I want it to look youthful. So we do rejuvenate that. It's part of planning. That's what makes a good tummy tuck or a great tummy tuck, which we'll get a great one on you. I like a smile incision. I extend along here. Now we get into something I see a lot here too. We got a little tattoo coming up. Often, you wouldn't design around a tattoo because people can redo them, but yours is going to be pretty nice because all we're going to do is take the top off here and we're going to leave everything else. So it'll be fun. Yeah. And you can modify that if you want to. Then we're going to extend around to the back, which we're doing a BBL here. This extension around to the back allows me to remove a bunch of skin down here to actually lift your butt up. So this is essentially a circumferential. We're going to lift your butt with an excision that extends here. We're going to lipo your whole back to snatch your waist in. We're going to then fat graft you to get hip shape. You have decent tissue here on your butt, but we're going to pop it and round it because what everyone wants is that snatched waist. Waist comes in, hip come out, back in again. We're going to take a little thigh fat because we need the BBL fat. You can't make a huge BBL very easily. You're going to have a nice round full one. We'll have just enough fat to do it. So that's perfect. Our order of surgery, we'll do the lipo first because we go 2 positions. We'll do the BBL. Then when we flip, we'll do the boobs first because since we're putting an implant in, we keep everything really sterile there so the implant doesn't get contaminated. And finally, we'll do the tummy tuck and you'll be done. You wake up with a little drain coming out right here. It'll be simple. You have all your girdles on. You won't have to do a thing. Just go home and chill. And then we'll see you the next day. We'll take your little pierce out together. We'll see you the next day and just look at everything. It's kind of a basic report card. I just tell you you're doing great. Look at what your drains are doing. Then we see you at about 10 days, 7 to 10, and take your drains out. And that'll be kind of your course. But we're going to take great care of you. You're a great patient. You ready to roll?
Absolutely.
You got anything to say to our guy over there?
I'll see you on the other side.
There we go. All right.
I'm gonna put these ones.
No, I mean like to go
No.
right now.
No. And then your legs are gonna swing right over here. You're gonna have a little pillow for your head. Perfect. We'll get you nice and cozy.
This is the good stuff. This is where you get to relax, have a nice little medication here, kind of melt away any kind of anxiety, really put you in a really happy place, okay? You just hang tight. We're going to hook up some monitors. We're going to start giving you some oxygen and some medications.
You make sure you monitor in case I wake up and dose me up so I'm not waking up there.
Absolutely. I'll be here with you second by second throughout the entirety of the case, making sure that you're safe, that you're deeply anesthetized and asleep and comfortable, while also treating any potential pain or nausea or anything like that for when you wake up. How are you feeling that?
Oh, absolutely.
Awesome. Told you.
Oh, yeah.
Any last parts?
It's going down. We got this. I'm a whole new person.
You're gonna be. Okay, I'm gonna put this mask. You're gonna take some nice deep breaths all the way in and all the way out. Are you counting? Count Skittles, girl.
You can taste the rainbow, you can do whatever you want to do. So this is a general anesthetic, which is necessary for this type of procedure. We're doing a lot of extensive surgery today. And in order to do a general anesthetic, we test the breathing tube, the endotracheal tube, and maintain the anesthesia through that endotracheal tube, as well as medications IV. And the way that we do that is we have an anesthesia machine that allows us to utilize our different technology type things, which allows us to monitor oxygenation, respiratory rate, heart rate, rhythm, and then also the amount of anesthetic that we're delivering. And it gives us also feedback in the depth of anesthesia and how well the anesthetic is being utilized. And so once the patient is under anesthesia, what we're doing back here as an anesthesiologist is making sure that the patient is stable, all of their blood levels are appropriate, that they're breathing appropriately, that we're giving medications for pain and nausea, blood pressure changes to anticipate any kind of pain or nausea when the patient wakes up, and also ensuring that the patient is comfortable and fast asleep or under a deep anesthetic during the surgery. So whenever we place this device called the laryngoscope, it allows me to gently and carefully making sure that I'm not touching the teeth or the lips or anything that can cause any issues. And this allows me to look at the vocal cords, lead to the lungs, and place a breathing tube gently in there so that I can breathe for her and deliver anesthesia throughout the entirety of the case. I take that out gently. With anesthesia, there's a lot of finesse. You don't want to be aggressive or heavy movements. You want to have light movements and precise. And so with that, here, I'm going to add a little bit of air to this balloon, which secures the breathing tube in the appropriate location. And then I can deliver breaths through the anesthesia machine. See the lungs expand, the chest rise, and know that I'm in the appropriate place. And that's that. And I'll secure the breathing tube and protect your eyes. And we'll go from there. We try to be very mindful and careful of the lips and the teeth and the nose and the face, because successful anesthetic is more than just being fast asleep. It's ensuring that all of the other aspects and details are taken into consideration and taken seriously, so that you wake up comfortable in all aspects.
So putting on these SCDs, this is going to give her massages in the calves as she's sleeping. That's going to prevent blood clots and the blood pooling to her legs, keeping all her blood circulating.
Now we're doing the liposuction part of the BBL. So there's two purposes. We're going to remove fat, sculpt the waist, snatch the waist, bring this in so that we can flip over and inject. There's liposuction, lots of questions about liposuction, lots of different devices. I love this thing, power-assisted liposuction machine. You can see it shaking there and moving. So that is like a power jackhammer to remove fat. I think with liposuction, this is the number one thing. There are a lot of techniques that tighten skin and put energy into skin, and we have those, and those do deliver some help. But honestly, it's about how much you remove. And this thing is great at that. You can see that I'm not, this thing is power itself. I'm gliding that in there. It's breaking up the fat. The fat is coming in that tube, and it's going to go in that canister right there. That canister is completely sterile. Obviously, if you're going to re-inject fat into someone's butt, it has to remain in the sterile system throughout the process. So that's what we do. We have a sterile canister to collect. When I pull this out, you'll see the fat go into the canister. We'll fill that up to this 1,000 cc range. And then we'll flip her over, we'll lipo the back, and then we'll inject. So we'll show you that next. All right, we're ready for the BBL. Now we've got our sterile container, fat in there, pretty pure fat, about 98% fat will separate out the liquid. So we inject a pure mixture. We've done that. This is the back side, 650 to 700 cc's. Front side, we took 700 cc's. We've got it in these syringes. There's no fluid in there now. All the fluid has been removed. I'm a hand injector. I inject by hand. When you think about BBLs, you do think about safety. You can see that this injection port is big, first of all. The reason it's big is to avoid going into any of those blood vessels and causing a fat embolus. It also fires to the sides, not out the front. So if you go in a vein, it's not going to shoot in there, it's going to shoot out the sides. So that's the safety factor. Then I come in, I've got my ports here. This is a hip dip BBL. We're going to give her hip shape. She projects, we'll put a little bit here, but our majority is on hip dip to curve that out. Then you can see here, I've lipoed this, and I'm going to take all this skin away to snatch the waist. So we have tight waist, smaller waist, project the hip dip. Now some people, now when you inject, you come forward, I stay, you can see my cannula. That's why I'm not in the muscle. When you inject in the muscle, you greatly increase your risk of a fat embolus. So I get in there and I inject on the way out. I pull back so that if I'm in a vessel, I pull out of it and I don't inject in it. So there's a lot of safety features along with the BBL. So we're just pulling back and we're doing her hip dip. Now purists might say, why are you injecting her before the tummy tuck? She's gonna be laying on that. Well, number one, this is a hip dip BBL. The fat is going in out here. When we flip her over, she's gonna be laying right here, so it's not gonna compromise her fat at all. So basically, people would say, oh, 700, not a ton of fat, but it's plenty of fat for a nice hip dip. We're not trying to create an enormous BBL. We're trying to reshape, snatch waist, and create a nice hip dip. So that's the process, and we just continue to repeatedly inject these. We sculpt that. After we've injected, we will massage that in, because when you stay superficial, you get a few little bumps like that where the fat is, because you're not in the muscle, which you don't want to be in. At the end, we massage all of those out to get rid of that. You can see her already taking shape. In the end, I'll come along here, and I'll give her just a little pop for symmetry. We don't want to just create a wide butt. So I will, maybe 20% of the fat, I'll place here for a little projection. When it's this small of an amount of fat, I'm not particularly worried about fat loss because it's such a small amount. So that's our process, and we're going to inject this all out. Then we're going to come in and snatch the waist. You can see it. I love this procedure when we take this off the back because I think it really shapes things out. Visualize, there it is. Hanging, square butt, perky, elevated butt. You can't create tight skin with the fat. You have to physically tighten the skin. Great headway here. We've lipoed this whole back. We've lipoed the waist in to get this all tight. We've projected the butt. When you look from that angle, you can see the butt's now coming up. I really focus on this shelf right here, lipoing that down, so we get this nice curve and then a shelf to the butt. So our butt is lifted, our shelf is lifted, and our hip is lifted. When we come in this way a little bit, you can see the curve of the hip dip being created, but then you see this blob right here. That would be technically a dog ear if you did a normal tummy tuck. So if you stopped way up here on your tummy tuck, you can see that all this stuff would still be here. So to offset that muffin top or dog ear, we're going to excise all this skin, and you can see that's just going to bang, tighten that up, lift the butt up, make the butt skin tight, and even snatch this in more. So this is the next phase. Circumferential body lift, remove this skin, elevate the butt, tighten the back skin. This continues around to the front with the tummy tuck, so it'll just keep going like that, and we'll keep taking more. So dog ear excision, butt projection. Side all teed up here. We got this side, skin excision, fat excision, BBL done. So we've got our shape. You can see the skin is very tight now. Remember how we had that floppy skin here? That's gone. Also, when you look at this, we got all these stitches inside here. How do plastic surgeons get good scars? We do what's called layered closure. It's critical on something like this. We have deep stitches down in the fascia in there, pulling everything together to take tension off this. You can see this thing's pretty closed, but we don't have any stitches in the skin yet. Then we do a second layer in the dermis, which hold that together. We'll tack that dermis together perfectly, and then we'll do a superficial layer, basically an epidermis and dermis to close that. So 3 layers, layered closure, good scar. We've really shaped our hip dip out, and we've got the waist coming in. If we come over here, you can see that it's not like that. You can see all I've done here is just score our mark. This is our upper incision. I'm going to make a lower incision through this tattoo. I'm going to lift up. So over here, we're floppy. Our skin out here is loose. We would have a muffin top. All of that's going to go, and we're going to pull that tight. So we get a nice waist curve here. Recreate the same thing over here.
So incision is done, final layers, little tiny interruptions on the skin, but barely any, and that's to just make sure the incision is absolutely perfect. We also inject marking, which is a long-term anesthetic, and this should help with pain relief for about 48 hours or so. So we'll go ahead and inject that into the incision, and that's going to help with the burning, and the patient isn't going to have to take as much pain medication. We also use this while we put the implant in, and that helps with pain control as well. And then I'll put some glue, I'll put some steri strips, we'll flip her over, she's good to go. Just flip the patient over. We've already done the back part, and this is a good visual to show how the dog ears would be if we didn't take that extra skin from the back. So all of this area is going to be removed, and she'll have a nice Coke bottle shape.
We've lifted this side, we've done everything we described. We've tacked the breast tissue up, we slid the implant in, implant under the muscle, spare nipple circulation. We're gonna use this little cookie cutter to create a perfect circle. I'm gonna lay this on here right where I want the nipple to be. It's like making a Christmas cookie here. And we're gonna put that down, and it's gonna leave a nice little blue line. We'll cut this skin away, and under there will be the nipple, which we will pull up through. Now if we sit her up, you'll see how much we've raised her. So we'll sit her up here, and you'll see we've got a 325cc implant in there, just enough to pop her up and hold her up. And now, when we look, we're nice and perky here. We've got essentially, I would say truly, we have no upper pull fullness at all. That's because there's no implant there. You can see how we are really full on that upper pull. You look here, there's nothing. You look here, this drives people nuts because they feel their skin on there. Oh, I don't want to feel that skin anymore. Well, you do a lift and an implant, you're not going to feel that skin anymore. We made a circular incision around the nipple right there. It's sitting right underneath here. We'll make the cut and pull it through. You make them submuscular pocket. I made an incision. This is a cool tool. It's a fiber optic retractor. It's lighted at the end. The light comes in through this. I slide that in, and I can just move all around here and see her muscle everywhere. So I'm underneath her muscle. First move, submuscular pocket. all the way up to the ribs so that the implant will fit. Second move, this is a sizer. This is not a permanent implant. This is how do you judge what you're going to put in? Well, you put something temporary in, you look at all the different sizes. We've already done that, so we know where we're going. But now you'll see how we size her up. We're under the muscle, 60 cc goes in, and you'll see her pop up. 120, 180, 240, 300, and then we'll go 325. And there we go with that, 325. So now we see our size. When I pinch this skin out together, I can tell that the tension is perfect, that we're gonna have a nice tight perky boob, but not too tight so that the skin won't come together, and not too loose so that we're floppy. So that's how we do it. After that, we're gonna take that sizer out, and we will replace it with this permanent silicone implant, which is pre-filled. And we'll slide that in. So that's how we do it. We also place Marcaine in there. As I said, these procedures don't hurt often as much as people think. Well, this is part of how. Because we take this Marcaine, we put it in this submuscular pocket, and actually the nerve comes out between the 4th and 5th rib right here, so you can put it right there, and that's gonna kind of block that area. So we do spend a lot of time consciously trying to decrease your pain so that we decrease your narcotic use and make it a better experience. Great example, tummy tuck. Teaching points, number 1, low incision, like I said. This is gonna be your final scar down here. That is gonna lift this whole pubic area up, so it's nice and tight and rejuvenating. When someone like this stands up, it all hangs like that, and they hate that. So we're gonna do a pubic, lift all that up. Next point with all tummy tucks, everything from the belly button to the pubic hair is gone. What's cool is that's the vast majority of her stretch marks. This is the only way you're getting rid of those stretch marks. So everything from here to here is gonna be gone. This point is gonna get pulled to here. After we do that, we're going to tighten her muscles about this far in, my guess, all the way up and down. Waist comes in with the muscle tightening, skin goes away. I will show you all of that. This is cool over here because a standard tummy tuck, this is extended. You saw, this goes all the way around the back. If you did an extended, the arc would be like a standard tummy tuck, the arc would be to here. So when you close that, you'd have this mound of tissue right here, and that's what a dog ear or a muffin top is. So the extended tummy tuck allows me to come around to the back, and my incision goes all the way around so I can take that whole dog ear out and create the best possible waist. So phases, excision, muscle tightening, skin removal. Now we're doing the tummy tuck. We've lifted everything. This is the skin flap that we lifted. It's thick. All that fat is going to be removed. That skin and fat. That's going to have a good weight to it, 8 to 10 pounds probably. I've lifted that up. This right here, I'm on that. That's her ribs. So we're beyond her ribs. We're all the way up. This is her xiphoid. This is the sternum, right at the very bottom. So we've gone to that. We've lifted all that. Now I'm going to tighten her muscles up. This white here is her muscle fascia. That's all fascia. This distance here, 2.5 inches, is the gap distance between her muscles. That gap distance is created by weight gain, having multiple children. She's had both. So those kids get in there, they separate these muscles. The muscles bulge out to the side. When you stand up, that allows your abdominal contents to bulge out like you're pregnant. So what do we do to correct that? I come in and I put a stitch in that. This is a V-lock, a big V-lock stitch. And it's looped. And I put this stitch in and I pull that together like an internal corset. So you will literally see me pulling her waist together, tighter. And I just keep following that blue line all the way down, tightening up her muscles, and you will see how much smaller her waist will get. So the purpose of plication or internal corset, I call it, is to make the waist smaller. That is all that does. So I'll spare you watching that all the way down, but you can see what we're gonna do. The cool thing about a V-lock, I said it's a barb stitch, is look at that. I let go and it just stays there. That thing has little teeny barb. I don't know if you can zoom in. It's different than a smooth stitch. This stitch is probably $80 compared to $8. So it's a big difference. But those barbs hold so strongly that it holds together. I hardly have to put knots in it. So you can imagine we got this stitch sitting in there. This is big. I could practically pull you up with this thing. Nice tight plication. We'll put another one over the top. When we do the layered closure that we talked about earlier, we use these V-locks in here too to get a nice deep layer of closure. I think these are the key to good scar, is precisely placed V-lock suture. So right now, back to the point, muscle plication. All right, now we've tightened that muscle. You can see before, if you touched it, there would be a wave. This is tight. There is no give there. Her muscle is perfectly tight. The skin has all been lifted. How much skin are we going to remove? Well, we're going to flex the bed and get all these parts out. But there's my fingers right up here, and we're going to get all the way up to my elbow. So basically, from my hand to my elbow, we're going to remove all that. So the way we do that is we flex the bed. So AZ will flex the bed for us here, and you'll see things just coming up. Because right now it's, wow, how's he going to get that close? Holy cow, there's a big gap there. Well, he's going to flex the bed, and that's going to help us. So this is the trick to a tummy tuck. We get you in the jackknife position. We get you very tight. Tighter the better. We pick a midline spot. I feel pretty strongly that we'll get this belly button pierce out. So we'll cut that, so that's gone. So we've done a nice complete tattoo removal in a single phase. We've done a belly button pierce removal.
gonna get nice and deep into that fascia plane so that it holds tight. This is our first layer of layered closure. I'm gonna line that up in the midline. I've defatted her pubic area so we don't have that hanging tissue. All that fat in there is gone. Bed's pretty flexed. You can see her feet. Her feet are almost up in the camera. So we've got her tight in there. It's gonna come together nice. So what looked not closable is now closable. And we'll get a nice tight bite there, and we'll show you and we'll bring it all together. Gotta get one more bite so we're nice and strong. And then we'll bring that together. Christina will hold that skin nice and tight for me so that we can get it tight. So here comes our knot, there comes our closure. You can hear the violin string nice and tight. First key stitch, that's in there well. She'll trim that, and then we'll do what, this is very standard. We just pull this down. I take the knife. Ironically, there's my blue line. That's how well these things line up. I make a cut here, right along that blue line that we actually predetermined perfectly, and we'll cut that. All of this skin and fat will go. Everything from my fingertips almost to my elbow. We'll bring all that down, and you can see that just snatching that waist. We'll put good lateral tension on it so that we really tighten with the lateral tension abdominoplasty. We'll make a circle about right here. Her belly button sitting right under there. We'll cut that, and the belly button will pop out through it. Fun view here. So you can see how flat that stomach is. We tighten the muscles. You can see the extent of what we're removing. You can see how I'm going to snatch all that down like this. And we're gonna have a nice tight waist, nice tight tummy. That is jackknifed, and that's how we execute it. All right, it's kind of summary. This is how much we removed. Thickness, skin and fat, width. This is a quarter, just to kind of put it in perspective. What's 1/4? So we took a lot, that's a lot of quarters. This is her outer edge of her dog ear that we removed. This is the tattoo above the pubic area. This is where her belly button came through. So that's all the skin and fat that we removed. It's dramatic. We'll show you it on top of the tummy tuck in a second, but we're wrapping it up. It was a beautiful case. Favorite way to illustrate what we did. This is our specimen. This is obviously what we removed, skin and fat. We'll take this away and you'll see that it was basically her entire stomach. So this piece was essentially all of this, entire stomach. Stretch everything down. Breasts are up, they're nice and high, everything's perfect, so we're done. These are actually the dressings that you'll have on. They're stuck on there, they're waterproof. When I see you on post-op day one, I just look at all this and say you can take a shower, water can run over these, put your binder back on, and that's it. These stay on for about a week. At that time, we remove these little jets and drains come right out the side. It's not as painful as people think. We change you to a different type dressing, and that's all there is to it.
All right, here with Brittany, day one doesn't look like it. Look at the smile, she's crushed it. This is a nice look at a nice faja on. We've got compression on the arms, compression on our breast lift. See how perky we are? You can see the snatched waist. You can see the compression of the breast. Drain output, this is normal. This is what you want to see, no problem. So today I just look at the drains, make sure you're not bleeding, check on you, and how are you doing?
I'm doing great. Pain management is good. Faja's nice and perfect. Doctor is available for me when I need them at midnight.
How'd you like the Bristol?
Oh, it's great.
It's good, right?
And I
it's
like
close by.
It's perfect.
It's good. So yeah, they stayed at the hotel, which is right next door, and headed home to near Sacramento, road trip and back.
Yep.
Ready for the car, and we'll check her out in about a week and take her drains out. Thank you. I'm here with Brittany. We're 5 days post. Big operation, breast lift, implant, nice 400cc size implant. We were trying to get, I'll show you when we get around again. Now we're on the back. We went circumferential. Our incision goes all the way around. Why did we go circumferential? Because we want to snatch that waist. We want to bring the waist in and avoid the muffin top out here, which we did. Even now, even at 5 days with all this bruising and all this swelling, we have this curve coming in, out, hip dip filled by the BBL. So that was our strategy. Liposuction heavily here, add to the butt here so we get that curved shape, which we achieved. If we had stopped our tummy tuck here, we would have had a big muffin top out here and it wouldn't have looked right. So we went hard there. We lipoed normal bruising for a BBL. This is what you can expect. It's sore. I mean, you have some pain, but you're tougher than the average bear, but you cruised right through this. And we put about, I think 600 or 700 cc's per side there. Mid to 400cc breast implant with a nice lift. We really focused on upper pole fullness. Tighten the muscles all through here. Mom liked how the stomach is tight right here. That's because we pulled those muscles together with an internal corset, which we have video of. Next visit, we saw her today at 5 days take the eyelid stitches out. Marlene can zoom in on those next time. But these are the drains. They'll come out at 10 days, 7 to 10. So 7 to 10 days, these are gone. Belly button is nicely sucked in. Beautiful, it's gonna be well hidden. And her eyes are ready for makeup tomorrow. So how are you doing?
Great.
You are great.
I have a lot of energy. I mean,
You do.
I'm great.
You're one of those that we have to kind of like put the brakes on you the whole time. Like, don't.
Yeah.
But that's good. But you have a great outcome. Bruising will be gone in a week, and you'll just keep cruising.
Thank you.
So thanks for sharing your experience with everyone. They'll really find it valuable.
Absolutely.
People have a lot of questions, and this is quite helpful.
Yep.
We'll see you in about 5 more days. Take your drain out.
Okay.
Thanks.
Thanks.